So I'm going to talk about some of the restraint and positioning things we might use for taking x-rays, depending on that. So here we've got one of our cradles. So this is something we use for most patient positioning here in our clinic, because it just makes it so that we can get clear and easy imaging and positioning for patients because of how it is. It's got little things in it, so you just change it around to how you want the patient to be positioned. We also have foam blocks we use positioning different things. So you see like that, or we wanted to get under back like that, things like that. We also sometimes, if we don't want to be in the room, but we need arms or legs moved back and still making sure to look after the patient, we cut some of this tie. And we will do a loop. Like that. And then there are little ties underneath the x-ray, so obviously this isn't long enough, and you wouldn't make it super tight because of the patient, because you wouldn't want to be. So there's little ties under there, so you put that under there, onto the tie, onto the lock thing, sorry. So that would pull it back and mean that you wouldn't have to be in here while the patient is having x-ray. We also sedate patients who might need to be sedated, firstly to have them positioned well and not have them moving, and so therefore lower radiation of the patient, but also for staff, so that they don't have to be exposed to x-rays and things like that. So it's very important when we are conducting x-rays and stuff to treat the patient with the utmost care. Of course, there are some fractious patients that come in, those are probably the ones that are more likely to sedate. It is better not to sedate them if you can, but sometimes it just becomes a case of needing to do it for the patient's safety and also for the clinic safety in regards to x-ray issues. There's a couple of things we'd do for restraining a patient and for positioning, and of course also be depending on what the veterinarian wanted, to sedate or to have the patient be moved, because it's very easy to mess up x-rays with just slight movements and things like that. Thank you.